Bonjour à tous.
Hello, everyone, and welcome to this press conference concerning the preparation of the Quebec health system to a potential second wave of COVID-19 in Quebec. I am Marguerite Quebec, and the press conference will take place as follows. The Minister for Health and Social Services, Mr. Christian Dubé, will speak first of all, and then the Minister responsible delegated to Health and Social Services, Mr. Lionel Carmant, will speak, and then it will be the Minister responsible for Seniors and Caregivers, Madame Marguerite Blais, who will speak with you. Mr. Christian Dubé is going to start. And then there will be a question period for the media, in which the National Director of Public Health, Dr. Horacio Arruda, will also be available to answer any question. Without any further ado, I'm very happy to give over the mic to Mr. Dubé. So, Ms. Blais, Mr. Carmant, Dr. Arruda, I should have said Dr. Carmant as well. So, dear colleagues, I would like to say hello to everyone. Very happy to be in Quebec today. To go right into it, Quebec remains today, as the rest of the world remains. Quebec has experienced an unprecedented crisis in the past few months. Faced with this crisis, collectively, we had to show great resilience. And I think particularly about all the healthcare staff. In this context, we had to set up solutions that were quick, efficient, adapt ourselves to the evolution of the virus, and the knowledge that we also had and everything that public health had. We've often made the comparison that it was like learning to build a plane while flying it. At the request of the Premier of Quebec, we have set up in the past few weeks, we went over what happened in order to be able to arrive at solutions if there were to be a second wave. Before going any further, I would like to remind you that much before the pandemic, and I think that it is very important to clear that up, much before the pandemic, we were already confronted with numerous challenges in the healthcare network. And this is not going to come as a surprise to anyone that when we're talking about the challenges that we already had, we're talking here about challenges that have to do with, the people that we didn't have enough, our infrastructure, which are obsolete, and a governance where very often the people responsible were not clearly defined. Now, the events of this spring have highlighted many of these organizational issues that I have just referred to, not only in terms of organization, but also logistics. I often come back with the word governance, that is, who does what. So today, what we are saying to Quebecers is that we have learned an enormous amount from the first wave, and we were able to draw lessons from it. And these lessons come as much from what we did well as things that we didn't do quite so well, and we have to recognize that. Amongst the things that we did well, and there's many of them, our CHSLD attendant program was a very striking element of the first wave. You know that over 8,000 people are going to be joining the network as of September, and in fact, they are already being trained on the premises in many of our CHSLDs. But we also have a second cohort, I don't want to say a wave, but a second cohort, a second group of 2,000 people that are going to be starting as well in September. So 10,000 people being trained, that's unprecedented. It also has to be mentioned, our screening capacity. I've said it often during the press conferences that screening is really where it's so important. We've increased our objective. The objective that our Premier had given us a few months ago was 14,000, and we have set up a system which now allows us to reach many days where we reach over 15,000 per day. But it has to be said, I'm not yet satisfied with the reaction time. That is to say that we've managed to screen. We even went up to 18,500 people even on the one day, but it takes too long to get the results, particularly for those who have a negative result. We have to improve that. And also what's really important is we've managed to have agreements with Quebec manufacturers to produce material here. And that, in terms of autonomy, is very important. So Quebec has adapted itself to the situation in coherence with public health. But can we do better? The answer is yes, we can do better. And that is why today, and I want to come back to my example of the plane, is that today we can, because there's a certain period of calm, and I say that very cautiously. You've seen the numbers, you saw the numbers today. The number of cases has decreased significantly in the past few weeks, but we still are having deaths. The virus is still there. So if I go back to my analogy with the plane has landed, we can repair it, but it has to start flying again because there will be a second wave. And I'm saying this because I don't want people to be disappointed when we have either outbreaks in a hospital center or in a CHSLD or even in a school. What we've learned is to control things, to prevent properly and to control. So I don't want people to be disappointed. I don't want people to, when we see outbreaks, we said it and we're going to be repeating it. This will happen. So today we are presenting a clear plan that can be measured. So it's quantifiable. So it's a lot, but there are 9 different parts on which we are going to intervene. And I'm going to try to be clear around a few points. First, certainly we have to have a very important emphasis on all the places where the elderly live. That was the issue of the first wave, so we put a lot of emphasis on our plan for the elderly. The second element is everything having to do with the workforce, and I talked about it earlier on. The screening is going to be part of the solution, supply chain, and governance. So concretely, and what you have, and I'm thinking about the journalists who've had the time to look over the documents, but I'm also thinking about Quebecers who are listening to us today, who will be able to see at the information which is on our website. Together, we are going to mobilize ourselves around 9 primary focus, these intervention axes. First, we are going to identify a manager who is going to be responsible for each CHSLD. And then we're going to be recruiting orderlies in CHSLDs. That's already started, as you know. Third point, which for me is the most important, we are going to ban the mobility of workforce. That's very clear. Fourth, we're going to reduce the delays in the entire process. So in the screening process, what I said is it's in different blocks. There are parts where we perform very well, for example, in the labs. However, in the way in which we let people know the results, there's still room for improvement. Another very important point, how are we going to support the service offering which is optimal in surgeries? In the first wave, we put a lot of things aside. We did it in a general way in Quebec, but we have to do it in a more localized fashion, and I think that this is also an important element. Now, I'd like to come back to governance. We're going to be setting up a governance that is going to be much more clear, much more flexible. And for me, the way of doing this, and that is why today we have filed an action plan which has dates. That is to say that this is a plan that is alive and proactive and gives us the time to have discussions with our partners, with the CEOs of the CIS and the CIUS, in order to establish a dialogue with them, in order to make sure that the application of the guidelines in the field is practical. Therefore, the 9 issues that I just raised to each of those problems that I talked about at the beginning, we have found a solution, and a solution that is applicable in the short term. So all the measures, as I mentioned, are going to have to be set up by the 30th of September 2020, which gives us about 6 weeks to continue with our discussions. But I'd like to repeat it. I want to reiterate that many of these actions, and I gave you a few examples of them, are already being done as we speak. For those who doubt how rigorous we will be in the setup of these measures, be assured that there's a very clear order from the Premier to make sure that this plan is realized. So for each of those actions, we will make sure that we have one person who is accountable and responsible. And it is in that way that we are going to be able to respond to the Premier's mandate. Now, I'm sure that my two colleagues are looking forward to having their turn at the mic, but before doing so, I would like to speak directly to Quebecers, to the elderly, to the people who are vulnerable, but as well to the health care staff. I want you to be assured that we are going to set everything up in order to be able to protect yourselves together from COVID-19. You know, in order to do so, we need you. We need the collaboration, but also the involvement, everyone's involvement, the employees, the unions, managers, but also the public, who has done excellent work up until now, because it is together that we went through the first wave, and it is also together that we'll be able to get through the second and be able to have success against this virus. Thank you very much. And now, the mic to Marguerite. I'll come back to English a little bit later on, okay? Hello, everyone. For those who hadn't noticed, today I'm wearing a mask, a smile mask, Sourire. The Sourire collection from Mr. Simard and Mr. Héroldi, as the Premier wore last night, and they're going to start selling in September. For each mask that will be sold, $1 will be given to the Sourdine Foundation, which is a beautiful action. Thank you, Christian, Mr. Dubé, Ms. Blais, Dr. Ruda. I'm very happy to be this morning with you in order to be able to present the action plan that we have prepared in case there's a second wave, which of course you'll know that we want to avoid. We have prepared ourselves by drawing lessons from the first wave, which we have to say really hit us very hard. Faced with uncertainty, we had to act quickly to avoid the worst. The pandemic showed out of all doubt that the Quebec society can adapt itself quickly to all emergency situation. The cooperation and solidarity of all Quebecers, as well as the respect of the imposed guidelines, were key elements that allowed us to limit the impacts of COVID-19. This being said, confronted with an unknown virus, we had to react quickly and efficiently in order to contain the eclosions and protect the public. Of course, we would have liked to have done more and better, particularly for our elderly and the vulnerable people amongst us. We heard the public, we have drawn lessons, we've adapted our approach if there is a second wave. I would like, therefore, to show you the objectives that we've given ourselves. First, it is important for me to limit the impacts of the health crisis for children, particularly those who have specific needs, people with a handicap, or those who have an autism disorder. And it is important to reduce also the effects of the health crisis on the mental health of Quebecers. Third, we have to maintain all services to vulnerable people during the health crisis, including the homeless. And finally, we have to make sure that we maintain the services, community organizations. These have to remain open in health and social services. As you know, people who live with an intellectual disability or people who are in the spectrum of autism, they need a certain routine to be comfortable. Therefore, we're going to be setting up measures to be able to counter the changes that have been brought about by the health crisis. In this sense, we want to deploy and offer services for support at home and care at home that is better structured, including a personalized approach so that families can go through this crisis without putting their own health at risk. The confinement approaches, as well as the services to children and young vulnerable people, will be reviewed to limit the impact of the crisis. For example, to maintain youth services, we have invested $90 million and allowed the recruitment of interveners as of this summer in order to not be able to remove services from other programs to help young people in difficulty. For example, we're going to maintain the screening and early intervention for the 0 to 5 years age group, as well as readaptation services. A more targeted confinement strategy will be deployed to decrease the number of isolated young people and children and ease the action of our social network. So this will be harmonized depending on the different areas and clientele, and we will make sure that things are well understood by people who work in the field. Measures to limit the effects of the health crisis on mental health will be set up, such as online tools for the self-management of emotional health. These will also be brought forward. We will continue with the awareness raising, inviting people to take care of themselves through, for example, targeted messages, and we're going to favor access to psychosocial services that are available through 811 Info Social, and the recruitment of 200 different interveners to be able to come and help the public. Certain CIS already have teams deployed on the field. In the field, we already know that the question of homelessness is very worrisome, particularly in our great cities. We have therefore developed an adapted response to this vulnerable clientele. We're going to establish priority and services that have to be maintained, and the preventive measures and control of infections that have to be set up in the different housing areas and complementary services. We will continue supporting our partners in the setup of temporary services in collaboration with the municipal and community organizations. One last point, which is of capital importance, that will allow us to set up this very ambitious plan, the service offering of community organizations. We saw their work is essential in our society, and it is even more so in the case of a health crisis. We are therefore going to make sure that the funding of community organization remains at what it is. It needs to be for the entire length of the health crisis. As you see, we did our homework and we'll be able to set up our plan if there is a second wave, and we'll be able to do this as of the fall. Thank you, and here now is my colleague.
Merci beaucoup, très cher collègue, Dr. Carmant, Monsieur Dubé, Ministre de la Santé.
Thank you, dear colleagues.
De la santé publique, mesdames et messieurs.
Ladies and gentlemen who are listening to us and watching us, please allow me as well to mention the presence of Ms. Dominique Savoy, our new delegated minister at the Ministry of Health, and to thank her as well as her team for the work, the very good work that they've done in this action plan. So between very difficult moments that have been experienced in the past few months and those that are expecting us perhaps in the context of a possible second wave, it is now time, more than ever, to prepare ourselves to protect those most vulnerable. There is no doubt. It is the elderly and people who live in those housing, long-term care that were the most affected during this crisis. And I would like to once again offer them my most sincere condolences to the families and loved ones of the victims of the pandemic. I also wish to assure you that we are deploying every effort so that we never go through these human dramas as the ones that shook up Quebec. Despite all of our efforts, CHSLDs and residences for the elderly were our Achilles tendon in the management of this crisis. For me, it is absolutely necessary that this pandemic can be used for something, and that as a society, we come out of this grown. We owe it to the victims, and we owe it to our elderly. It is clear that the pandemic does not justify on its own what happened. It shed light upon problems that already existed in the health network that were exacerbated by the crisis context. for a long time, for too long now. Our CHSLDs should have benefited from more attention in Quebec and a lot more love. We are living with the consequences of these decades of inaction. No one can forget the human drama that took place in certain CHSLDs, private CHSLDs. The case of Heron, sadly, is going to remain in people's minds. A person's quality of life who is housed in one of these places should never be different from one housing to another. The safety and the well-being of the elderly has to be ensured in order so that the person wherever she is going to be equally well treated. Our government has drawn lessons from what we have experienced. The plan that is being revealed today shows it. The actions that are presented there will be used not only to prepare a possible second wave, but the benefits of this plan are going to be felt beyond the pandemic. Let's think about the 10,000 orderlies and CHSLD attendants who, thanks to an unprecedented recruitment campaign, and we didn't even believe it at the beginning. Well, I mean, we believed it, but some people didn't believe that it was possible. So these CHSLD attendants are going to add themselves to the health network to take care of our elderly. Thanks to our action plan, it is the culture in these places, in these homes and these care centers is going to be changed. So our way of taking care of the elderly is not ever going to be the same again. And we're going to have the first policy for long-term care in the history of Quebec is going to be filed this summer. In the heart of the crisis, our government had already made a priority of ensuring equity between the different care centers by giving a financial help of over $133 million to the housing resources. Our government commits itself to reinforce these private care to offer the same level of care in all types of housing. We saw during the crisis how essential it is to ensure accountability in the field. One of our first actions targets identifying, as Minister Dubé said, a single manager per CHSLD. This is a priority, and I can assure you that this will be done very quickly. During the crisis, the isolation of the elderly was one of the most negative effects for their well-being. Forbidding access to the caregivers was a decision that is heartbreaking. You know my personal attachment to this cause. We know more than ever the essential role of caregivers for the physical, cognitive health of the elderly. But it had to be done to protect those most vulnerable. Now that we know the virus better, we are confident that their access is going to remain. They will still have access to these care centers. So with all the action plan, we give all their means to decrease the risks of spreading the virus while maintaining safe access to caregivers if there is a second wave. This is a considerable gain. Our government has also filed a historic bill in order to support and put more value on the essential work of caregivers so that these workers who work in the shade be finally recognized as full partners of the health network. Before the pandemic, we were already acting on different fronts to change the way in which we care for our elderly. Our project for the homes for the elderly and alternatives are a good example of the major transformation of health of long-term care centers that our government has already started. Also, we repeated it many times, and I'd like to repeat it because I consider that it is fundamental. The way of the future for the health network are home care. Our government believes in this fundamentally. We have to allow people who are losing their autonomy to remain at home as long as possible. We were already committed in developing this service offering when the COVID-19 crisis showed us to what extent it was essential to make this change. And last year, we invested $280 extra million as a support for home care. The action plan that is being presented today is a clear move on the part of the government to make sure that we never, ever relive the events of the spring. We are ready. On top of preparing ourselves for a possible second wave, this action plan will allow a true paradigm change in the way in which we care for our elderly. To end, I wish to salute the public for the rigorousness as far as the respect of health guidelines is concerned, and I invite you to continue being so rigorous. I also wish to most particularly salute the elderly, the people who are in long-term care, the caregivers, and those whom we've called our guardian angels. Together, we will have the strength of overcoming this crisis and to get out of it, and to get through it grown. And now give the mic back to my colleague, Minister Christian Dubé. So, thank you very much, Ms. Blais. And I would like to say a few words in English, and then we'll conclude.
As you know, the province of Quebec, like the rest of the world, has experienced an unprecedented crisis in the recent month. At the request of the Quebec Prime Minister, we have done an appraisal of this first wave, so we can now establish the solution to be implemented in the view of a potential second wave. Our government is presenting today a measurable action plan. It revolves around 9 areas of intervention, including living environment for seniors, the workforce, massive screening, supply, and governance. In particular, the government of Quebec is mobilizing in the following: identify a manager responsible for each CHSLD. We need to recruit attendants in each CHSLD. Prohibit the movement of employees. Reduce the time taken for the entire screening process. Support an optimal service offer in surgery. Establish clear and agile governance. Maintain a constant dialogue with the general managers to ensure the implementation of directive. And this is how we will respond to the mandate that the Prime Minister has given us. Together, we went through the first wave, and it is together that we will beat this virus.
Now I'd like to conclude this presentation quickly with a few words. On top of the action plan that we are presenting, we have to make sure that we have the human resources to support our actions. That is why I am announcing today that an important amount of $106 million is going to be granted as an emergency fund to public health. We wanted to make sure that we can protect the public's health and to better support the regional public health directors in their mandate. Concretely, this amount will allow for the hiring of human resources and to acquire material resources. We're talking here of about 1,000 people, 1,000 full-time employees. In this way, we can support our regional establishments in order to, for example, increase their capacity to quickly trace cases of COVID, prevent and manage outbreaks in different environments, and we know that it's not always easy, and coordinate the administration of a possible vaccine. That's a positive aspect, and we have to prepare ourselves for it. So thanks to our action plan, as well as the amounts invested in public health, we make sure that we have a more efficient organization and coordination for a possible second wave of COVID-19 in Quebec. Thank you very much, and we are now ready for the question period.
Oui, alors nous allons maintenant passer à la période de questions. Je vous inviterai à spécifier votre média, votre nom et à qui s'adresse votre question. On va y aller avec question sous question, comme il y a beaucoup de journalistes dans la salle. Alain Laforêt, TVA.
Alors, mon nom a été dit, je vais le répéter, Alain Laforêt, TVA. Bonjour à vous. Vous avez parlé d'imputabilité.
You spoke of accountability, and there was a nurse who was suspended in Joliette. You really reiterated that. The Premier already did as well. But what is the accountability of the government for what happened in the first wave? Mr. Laforêt, managers as much as elected officials are accountable. And in order to be accountable, because what we spent a lot of time in the past few weeks looking at is to make sure that people have resources and means to act in what we are asking them to do. I mentioned it, and I did so for a reason, that in the past year, we've seen it quite well. We arrived in this pandemic with few resources, a system that was fragilized, very difficult to make people accountable when they don't have the resources to act. So what I was asked to do, and I repeat it, elected members as much as managers are going to be accountable. But what we want to do with the action plan that is set up here, the amount, is to give the means to our managers as much as our elected officials to be able to work with the right tools. And that is what we're doing today. Follow-up. You have just announced 106 million, hiring 1,000 people. I'm not going to repeat what I said in the month of March, because I told you that you were living in La La Land, but you still found 10,000 people. But anyway, 1,000 people more with the 10,000, that's huge. Well, maybe I'll let Dr. Arruda answer this, but I would say that we're talking about two different things here. These 1,000 employees have all sorts of functions throughout Quebec. We're not here working on either, nurses or orderlies. But I would like perhaps for Mr. Arruda to explain a little bit the kind of staff that we need, what the functions are, and I'll be able to come back as needed. Well, it's always a challenge to go get human resources, but there really is an entire series of kinds of professionals which exist. For example, statisticians, epidemiologists, planning and programming experts who can come from all sorts of different domains, in health or others, and they do investigations. Certain nurses, but it's not just those professions. We even had, in the context of Je Contribue, all sorts of people who came and helped in order to be able to work in public health. Of course, tomorrow morning, the 1,000 people won't be hired by tomorrow morning. We do have contingency plans to help mobilize resources, for example, investigations in the Montreal region through people who work at Statistics Canada, who are already in the field and being trained. So I find this very positively. It will allow certain people, for example, who were going to go to get trained where they didn't know where they were going to go, well, they can now think about a career in public health, because many have discovered that. I was told recently that in the master program in Montreal, there's an increase in the number of people who are going into public health. So since we are less in a specialized profile of, say, only nurses, we therefore have in public health a series of people. It can be anthropologists or others who come and work with us. And I would like to add, if you'll allow me, the people who may be interested, and I think that it's going to be a very captivating domain for the next few years, call us and contact Je Contribue, and we're going to take all the necessary information for anybody who might be interested by any of these positions. Mr. Dubé, you talked about the mobility of the workforce. We know that it's something in the first wave that was very difficult to apply. So when you say that you forbid this, how are you going to do it so that placement agencies, I understand that it's not just orderlies, it's nurses. How are you going to make sure how are you going to ensure that placement agencies are not going to send one team from one place to another? Yes, quite. Well, one of the reasons where we gave ourselves, the next 6 weeks is to be able to talk about the practicability of these measures with our managers in the CIS and the CIUS. Ms. Dominique Savoie, who is here with us today, we presented that plan this morning with our CEOs. We are talking with them and have been for a few months. There are many actions that already were set up, but what we want to make sure of with them is that in the next few weeks, by the 30th of September, is that there is an action plan, because it's not every single CIS or CIUS that were in the same place. Some people had bigger workforce problems than others. But what we have to make sure is that there's not going to be mobility of people by the 30th of September. That's for sure. And during the crisis, either. So now with the PABs, with the arrival of 10,000 people, it's less of a problem. We can go more quickly. Where we have an issue is still on the side of nurses and nursing assistants. That is why we made that clarification, and we ask CEOs and managers to tell us how they plan on doing so. And that is why we want to be sure that they are accountable and responsible. It's going to have to be done with the rules of PCI, so prevention, control of infections. So if ever there's a change to make within, for example, an establishment, and if that person must do so, they have to make sure that they respect the PCI rules. So that is what we're going to be doing over the next few weeks with the managers. And to specifically answer your question, if ever we need in placement agencies in certain regions, they're going to have to respond and follow the same PCI rules. For the new managers, can you give us an idea of how much it represents? Are these managers people who are already in the network? Are new positions being open? Are these people going to have more responsibility because they're going to manage many sectors? Or it's a question, it's a follow-up, but I'll try to... we're talking here about 400 CHSLDs where we have issues and about 40 CHSLDs, which we call private conventioned. So the principle is quite simple. We need one manager who's responsible, who's accountable per establishment. Where we're asking our managers right now, because in some it's already done, and it was done, for example, we don't have these issues all that much of having somebody not responsible. You know, regionally, it's easier to have somebody who's accountable. It's when we arrive in the big CHSLDs in Montreal, for example. So now what we have is that we ask them to complete these people. I can tell you that we already have some who have been found, and we've given ourselves to the end of September to go get them. So the positions are going to be posted in the next few days for those who haven't done so already. We already have looked at our people at Human Resources, at the Ministry, what kind of position, the cost of all that, and we can finalize that very quickly by the end of September.
Bonjour, Patrice Bergeron, La Presse canadienne. Bonjour à vous quatre. Monsieur Dubé,
Mr. Dubé, would you be able to guarantee to Quebecers that the response of the government to the second wave, the possible second wave, will be better than the first wave, considering the disastrous results that we had compared to all other Canadian provinces? Well, listen, what I want to tell Quebecers is what I mentioned earlier on, is that we have now set up everything that we need in order to succeed. I repeat it. There were labor issues, you know, the workforce. There were issues in relation to where our health network was before we arrived in the pandemic, which makes it that we had a lot of difficulties. And people are conscious of that. We only need to think about the lack of governance in CHSLDs, for example. We didn't have any local direction. I think people understand very well what those difficulties were that we had. But what is important for us is to tell Quebecers that now that we've learned, now that we've had these lessons from the things that we did well and the things that we didn't do well, well, now can we have a very clear vision and a very clear action plan? And I think that what we are presenting today in these 9 axes, I can tell Quebecers that we're going to do everything that we can in order to be able to respond to that, because right now we have the means of succeeding, getting through the second wave. Follow up? If you'll allow me, Mr. Dubé, we realized that there were a lot of cuts in, for example, prevention and control of infections clinicians. Over the summer, we trained quite a few people in order to be able to be ready concerning the prevention and control of infections. That is a major element that we can add that will make it that we'll know how to wear masks, how to wear the gowns, how to take everything that has to do with infections. Those people will be trained. So I have the impression that it's going to be a lot better. And we will no longer allow what happened in the past in care centers for the elderly. Well, just to be clear, if I understand correctly, you are committing yourself that the second wave, the toll will be better than it was in the first one? Well, to be very clear, look at what has been going on for the past few weeks. We have the opportunity of having and luck of going through a certain period of calm. But during that period, we still had outbreaks. We're not completely safe from them. And these outbreaks, whether they were community or in establishments, you saw what happened in Saint-Jérôme, in Saint-Eustache, here in the Trois-Pignons in the region of Quebec as well, we were able to test this action plan and to have the agility to be able to respond to it. So I think that what Quebecers, what I appreciate in your question, Quebecers, what they have to understand is that there will be other outbreaks. The virus is still there. But now that we've learned to work, now that we have the resources to do what we need to do, we can act quickly, because with this virus, our best weapon is agility and speed. So that is what we can tell Quebecers. We have committed ourselves to give ourselves the resources, and we show it every time when we have an outbreak that we can act correctly. Mr. Dubé, the main problems in the second wave was due to a lack of staff and the movement of staff and lack of material. So I'm trying to understand what naming somebody who's responsible, a manager responsible, what kind of error will that allow us to avoid for a possible second wave? Well, to your summary, I would add what Ms. Blais just mentioned, prevention and control of infections, PCI. There were a lot of lacks in terms of what people had to do in living environments as compared to a hospital environment. The entire question of prevention and control of infections in a hospital setting, people are used to that. They know how to react. Our nurses, the orderlies, they are used to having masks. They're used to protecting themselves. We had a lot of shortcomings and lack of training. And Ms. Blais just mentioned it. There were a lot of weaknesses because there was a decrease in the budget of public health in the past few years. The prevention and control of infections was one of our great weaknesses. So that is why today, not only will we have somebody responsible in every CHSLD, but under that person, there will be somebody who will be responsible for prevention and control of infections. There's a guide that was published in the month of June that we're going to continue updating, because for us, it is one of the elements on which we will support ourselves and base ourselves to make sure that the rules are being respected in each establishment. Follow-up. Mr. Ruda, a question for you. We saw many jurisdictions impose mandatory masks outside, globally or partially. I'd like to know whether that is something that is possible, that is being thought about for Quebec. Face coverings right now are mandatory in certain contexts where the 2 meters is not respected. But your question is for inside? Outside. Outside? Yes, in Spain and other jurisdictions, it's been imposed outside. Well, right now what we're doing is we're making it mandatory in public transportation in places where we believe that there might not be enough distancing. That is what the recommendation is. And possibly, depending on the response that people may have, we could perhaps do so. But I think that right now, we still have to keep one thing that's very important in mind, is that even if we're wearing a mask, what's important is the 2 meters. And I know that face coverings, and I don't want to come back on the debate on masks, it's important or not. It's essential right now, but people cannot forget the most important thing is the 2 meters and washing hands. Already, I would say we can see a trend where people are not washing their hands as often. People go into a business, they put on their mask, but they don't wash their hands. So I want to mention that the most important thing is the physical distancing, the 2-meter distance. And we believe that by requiring face coverings, as we've done in Quebec in certain situations, we should be able to just keep it at that. But I really invite the public to not get close, closer to than 2 meters just because you're wearing a face covering. It really is the use of a face covering in a situation where, say, we don't have the control. That is the information that we have to keep.
Excusez-moi, on va y aller avec le prochain média. Je suis désolée de vous interrompre, mais on va y aller avec le micro 2, s'il vous plaît. Madame Prince.
Quelles circonstances?
Excusez-moi, je n'ai pas entendu.
I'm sorry, I didn't hear. What circumstances would you impose it outside? Well, I think in all places, for example, where we think that the 2 meters might not be respected in certain gatherings or things of that nature. But what I'm saying, I don't want, mandatory mask wearing. And I'm going to repeat it, I don't want mandatory mask wearing to replace the 2 meter. I want to reiterate that. It is in family context where we have a tendency to get very close, where we see situations of outbreaks. Fortunately, we have succeeded in lowering cases. We are controlling all sorts of outbreaks and all sorts of situations, but each case doesn't generate that many because the intervention is quick. But if you want, to remember one thing, and I come back to the 10 people rule at home, the most important is to really respect the 2 meter distance. That is the most important. I would like to know, as far as the accountability of the upper management is concerned, in the second wave, you say that they're going to be accountable for those where it went badly in the first wave. As we get closer to a second wave, forgive my expression, but should we clean things up? Apart from the Joliette example, are there other places in Quebec where upper management are going to be demoted, for example?
Merci, Madame Prince. Pour le moment, non.
For the time being, no, because I'd like to repeat it. Our first analysis was not to find guilty parties. It was to identify issues a lot more. And I believe you had the possibility of reading or being aware. I really, with my colleagues, particularly Mr. Dernay, who is newly responsible to establishments, particularly for CHSLDs, we really wanted to talk about the issues, and I'd like to repeat it. If there are managers who are not able to do their work correctly, very often it's because there was a lack of needs. Or, for example, the guidelines were perhaps clear but didn't make it to the correct people. So I preferred spending my time with my team, making sure that we worked on those issues. And I'd like to repeat it. One of the reasons why today we are giving you this plan, which as far as I'm concerned is finished, but that still needs to be talked about with them, because that is where I'm going to be able to see the reaction of these people to all the means that we're giving them. So look at what happened in the CHSLD that we're referring to. If there is one person who called, is it the union who called? Is it employees who said there's a nurse? And now I want to be careful because we're going to be looking at what happened. But that is to say that the message is being heard. Now, there's a very clear guideline that was given. There will no longer be any mobility in the staff. So if that guideline is not understood and that a manager, regardless of their level, moves staff around, well, there will be consequences. So it is very clear. That is what we had to do as a first step. Also, in your plan with the 9 axes, I don't really see where flu is in there because there's a big question mark on that. I know that we already said earlier on this summer that you didn't have the intention of making vaccination mandatory, but right now, are you saying that we have to avoid this flu, this wave of the flu, so could we make it universal? I'm going to let Dr. Arruda answer this. We never made vaccination mandatory in Quebec. We do have that power in the Act for very high-level health problems. For example, smallpox made a comeback. But the measures that are set up for COVID-19, as far as we're concerned, are also going to have an impact on respiratory viruses. I mean, as soon as we put these flu, went down. And what we can see in Australia is the same phenomenon. But regardless, we bought 34% more flu vaccine in Quebec compared to previous years, and the vaccination program for flu will take place. We will keep the same risk groups that we had last year, that is, people who are at risk of having complications if they catch it. So, of course, it's a challenge, the epidemiology of flu-associated COVID-19 into all respiratory viruses, but we will be applying the prevention measures that are necessary. And I would invite you, therefore, to get vaccinated if you are amongst people who are at risk. It's a campaign that is going to start, as usual, around the month of October, November, usually around November. The clientele in long-term health centers and the residences for the elderly very often get vaccinated around October, depending on the availability of the vaccines that arrive to us and we get from the federal government. So the flu is part of our action plan, the ongoing one, regardless of COVID-19. But of course, we are going to be making the analysis of both throughout the autumn period.
Bonjour, François Garriépi, Radio X à Québec. Question pour M. Arruda, qui vient tout juste de nous rappeler l'importance de la distanciation.
Mr. Arruda, you're just reminding us of the importance of distancing. Seeing that the cases are decreasing from day to day in Quebec and the number of deaths is decreasing as well, do you have a timeline concerning wearing of the mask for the Quebec public? A timeline? Yes, an end-by date. Well, we've made it mandatory in public transportation and businesses. We're asking people to wear the mask right now. I would say that a very large proportion of people do so, but there are certain movements of people who oppose themselves, but we are evaluating the situation, but there's no date. Follow-up. What would be the criteria to allow people to stop wearing a mask? Oh, to stop wearing the mask. Well, listen, it's going to be difficult to tell you that we're going to stop it as long as we don't have the necessary measures, for example, the appearance of a vaccine. And I'll explain to you why. It's when we let our guard down that we allow the virus to make an upsurge. And I'm going to tell you, I am happy to see that we are in control of our outbreaks, that we went down below 50 cases in the course of the past few days. However, for me, that is not a sign where we let our guard down. This is a virus that is going to stab us in the back. We only need to let down our guard a little. And even the small quantity of protection that the masks can generate is what is important, because each case generates others and others and others, and that is where we end up in an exponential curve. So I'll come back to you with the fact that now we've managed to flatten the curve, but we want to continue with that. And in that sense, I invite all Quebecers to continue with physical distancing, and I know I'm rambling on. Distancing, washing hands, wear a face covering until we tell you that it's behind us.
Bonjour, avocate Marie-Michel Siouid de Voir. Est-ce que vous m'entendez? Je suis assez haut. OK. Je me souviens dans son rapport.
I remember that in her report, Ms. Savoie had written that there was a strong consensus about the fact that regions hadn't helped enough for the Montreal crisis. So my question is on reinforcements. Will there be measures to make sure that professionals regionally be able to come and help out in Montreal if there's a second wave that hits certain regions more? And in the same way, do you have the intention of, leaving aside social workers so that they can go help out in CHSLDs, occupational therapists? And okay, there's two parts to your questions. The first report, as the Savoie report, yes, the Montreal report how it's called, just to make sure that we're speaking of the same thing. It came out a few weeks ago, and it was particularly specifically on governance in Montreal between different incidences of public health, etc. So I just want to make sure that I'm answering your question correctly. And in that report, what had been one of the main conclusions, you're right, is that not only were there governance issues, but when we said that perhaps people hadn't helped as much as others, it was because people were working more in silos. So I'm not sure that it's really the regions, but perhaps it's a CIS or a CIUS that was really focused on its regional responsibility. We'll say it this way. You know, Montreal East or Montreal Centre or the Montérégie or regardless. And you're right that in that first report, we want to make sure that there is a better coordination, because very often we can have a problem in a place that isn't necessarily present elsewhere. So when you refer to, you know, leaving things aside, that is that Dr. Carmant talked about, is that we want it to be a lot more like a surgery, which is a good word to use since we're talking about health. That is that we want to offload, but we're not going to stop surgeries everywhere in Quebec if we only have an issue in one place. What will allow us to do that, and you know, I'm taking a long time to answer your question, but to go get people, either occupational therapists, regardless who the staff is, but in one region to come and help out, because over there we won't have offloaded anything. So that is where we learned that, yes, we had prepared ourselves well, thinking that we needed, you know, to free up 6,000 beds, but we weren't hit everywhere in the same way. So today we're going to be a lot more surgical in this way of doing things, not only in Montreal, which is one of the conclusions of the Savoie report for Montreal, but also for Quebec as a whole. If I may add, a lot of these occupational therapists and others came from the youth programs, and now it's clear that we've asked all CEOs to bring back those people for the 1st of September, because services for young people, particularly for the people living with a handicap, have to start again. So if there are any other offloading to do, it really is an ultimate solution, because we want for our young people to be able to have access to services in an optimal way as of the 1st of September. Follow up. What did you tell managers as far as the end date of the 30th of September? What is the consequence if some of them do not, you know, deliver? Are their jobs at issue? They will be accountable. I told you earlier on to the previous question of one of your colleagues, as what I no longer want to have as an excuse is it wasn't clear. Today it's going to be clear. We gave ourselves time to talk about it. The CEOs and people from the network who were met by Mr. Dernay, by Ms. Savoie, by everyone, the Federation of Specialists, everyone worked on this file, and they've been working on it for months. So now that the conclusions and recommendations are very clear, those people are now being given 6 weeks to be able to absorb this and talk about it with their teams, their boards, in order to make sure that now, as of today, and in the next few weeks, that those measures will be set up. Well, being accountable when you're a CEO, what? It's to lose your job? Well, listen, we're not here to specifically target one group or another. We saw it this week. It can happen to an employee who is important who's highly placed. So it's important to know who does what. And that is why very often there were things that weren't clear. And I'd like to repeat one of our big issues. And we call it's the PCI, the prevention, control of infections. And unfortunately, it's very often small details as far as PCI are concerned that weren't being followed that brings about beginnings of outbreaks. And when you have the beginning of an outbreak in the CHSLD, it's like a flame. It starts and it ends. So that is where everybody has to understand that they now have a role to play. And that is why we have an intervention guide together with PCI that is also going to be updated over the next few weeks. Yeah, I'd like to add something if you'll allow me. We're asking the question earlier on, why managers in each establishment, what is that going to change? Well, when we have guidelines, that means that it's going to go directly down to the managers who will have the obligation to make sure that what we have decided is also applicable in their own establishments, and if it doesn't work, that it is also what accountability is all about. In English now?
Good day. When you say that there will not be transfers, mobility of healthcare workers between long-term care facilities, you know how much there is still concerns of families for loved ones living in seniors' homes. In your plan, it's written that there is no more mobility unless il y a une rupture de service breakdown. So basically you're saying today, you're making that commitment that there won't be any breakdown of services. So that explains why the mobility of healthcare workers won't be possible anymore?
Well, I don't know if we lost the message in the translation, but I'll say it very clearly. What we said, there will be no mobility. I'm going to be very clear. It will be no mobility, and the only one that will be allowed will be with for nurses and auxiliary nurses under the one condition: they respect the our measures of prevention and control of infection. So it's not for préposés ou bénéficiaires. We have enough personnel now for that. The issue is with auxiliaires, infirmières auxiliaires, and nurses. We need to make sure, and that's the reason we give those 6 weeks, the next 6 weeks, to all managers to say, okay, now you cannot allow the transfers of people between floors or between establishments. So find a solution and show us that those transfers will be under the rules of prevention and control of infection. So this is exactly what we're saying.
Okay. Regarding the protective equipment.
And just, sorry.
Go ahead.
This is so important. If the English document doesn't say that, I will correct it in the next few minutes, okay? Because that's exactly the point of making sure there is no mobility unless that condition that I just explained to you.
Yeah.
Okay?
Question?
The protective equipment.
Yes.
Do we have enough protective equipment at this point? Are we stocking the protective equipment? I was surprised to read in the documents that you have to conclude agreements with Quebecers suppliers. That should have been done weeks, months ago. We should have sites with protective equipment, and those sites should be like not empty, but filled with protective equipment already.
Yeah. Okay. Thank you for the question, because we didn't talk a lot about that today, and that's one of those 5 issues that we've talked. Let's look at what we have done. We made sure now on those gloves, trousers, especially the mask and 2 types of masks. I'll talk about N95 and gloves. Say we limit ourselves to those 5. There are 2 that are still under, can I say, a certain level that I would like to be more. Gloves, because they're only manufactured in one place in the world. So we are dependent of them. And the other one is N95. All the others, we have the resources, we have plenty of them. The issue with N95, as you know, is that we've asked to be and Minister Fitzgibbon have made some arrangement with one company that now is setting up shop in Montreal. They will be ready to manufacture those N95 by end of October, beginning of November. But the time that we need for certification could last a month and a half. So the issue is that we will have plenty of N95 at one point. Is it December or January, we are in that zone. So what we decided to do, even though we'll be autonomous by, say, beginning of the year, that we're still buying N95. So we don't have the same level of N95 right now, but that's not going to be an issue in a few months because of the manufacturing will be done in Montreal. On the gloves, nobody wants to make those gloves because there are some big issue, environmental issue, the way they are being manufactured, latex and all those reasons. So we need to improve or to increase the number that we have, and our people at procurement are doing that right now. But for those two, this is the focus that we have. For the rest, we're okay.
Prochain média.
Good afternoon, I guess. My first question is similar to Katsi's. During the pandemic and the lockdown, I remember tons of questions from journalists saying, why are orderlies still moving between facilities? It was ongoing. There was a crackdown, but there seemed to be exceptions because we had a lack of orderlies. Why now? You say that this is the most important element of your plan. So obviously you're acknowledging that what happened during the first wave was unacceptable.
Well, we said that clearly, that mobility was not acceptable. The issue was when managers, if they, and again, I'll stress my point, if the managers didn't have the resources and had to choose between rupture of service or giving a service with taking a risk, some of them took taking the risk as a choice. So what we're saying right now, you cannot do that anymore. And if you cannot do that anymore, well, we make sure that over the next 6 weeks, you'll find solution and discuss those solutions with us. So that's the reason we gave this deadline, that is September 30th, because not all the CHSLD or not all the establishments have the same issue with personnel. So some in certain regions have different issues. So that's the reason we're saying mobility is not acceptable, and you have until September 30th to give us your way of doing it.
Sous question?
Yeah, I just have a very simple question. I'll address it to you, but maybe Dr. Arruda would like to also reply to it. You're giving yourself the timeline of September 30th, but what qualifies as a second wave? On September 30th, are you going to declare if the second wave has arrived or not? How will we know if we're actually in a second wave?
Okay, that's a good question. But I think Dr. Arruda can tell you, but I would like to say something before that. Our goal is really to control what's happening right now, because the virus is here. You know, we had over the last few days 6 deaths. We still have patients that are in intensive care, 27 of them. So the virus is here. So what I think we are is somewhere between the first and the second wave, but we're controlling it right now. To the good work of Santé Publique, to the good work of people doing prevention in the hospital. So we're somewhere between that. I think what we need to be aware is the phases that could happen. As an example, in hospitals. Right now, we are seeing in the first part, so we'll have, again, as we had before, hospital that can take patients of COVID. But if that phase increase, or if the number of patients is increasing, then we can have another way of dealing, adding number of rooms in hospitals. So I don't know if that can be completed, but we are monitoring the level of cases every day, as you see. Fortunately, we're doing all right now, but we are watching that very closely, very closely.
Prochain média, s'il vous plaît.
Okay.
Oui.
Okay, in fact, the minister answered very well to the question, and we know also that there is, those viruses seems to have seasonality, that, you know, like each fall, winter, there is influenza, there is other viruses, and that could come back. So it's why we never have to stop. We never have to think it's a way, because it's the first, when you don't do what you're supposed to do, you can see that reemergence and the stress on the health.
We don't want to see that. We don't want to see that.
My turn. Good day, Phil Lotier, Montreal Gazette. Mr. Dubé, I just want to run over just a clarification on your CHSLD. SLD. How many CHSLDs currently do not have a director? I think you said 400 had a problem still?
No. We have 400 CHSLD. Okay. I've asked Madame Savoie before printing the report to know exactly where we are in the hiring process. The issue is that I would say probably a good portion of them have a person that is responsible, but we need to make sure that everybody agree that this is the person that is responsible. So we are doing this exercise, and I think over the next few weeks we'll know exactly. But again, in different CIS or CS, sometimes it was called a coordinator, was called a responsible, or a floor manager. This is not going to be the case anymore. It's going to be one person that is responsible for the establishment.
You said in French that if people don't follow these orders, the mobility, the hiring of the directors for each CHSLD, there will be consequences. You said that in French. Mm-hmm. I have never seen a fonctionnaire get fired in Quebec in my life. Has anybody lost their job as a result of the first wave? And is this possible that in the second wave, because you're talking very tough, but we want to know, are you actually going to deliver?
Well, as I said to one of your colleagues, the job I was asked for this first report was to make sure that we identify the issues that we've been facing. And I will answer your question. We have identified clearly that most of our managers didn't have the resources to fight this virus properly in the first wave. They didn't have the resources. Whatever it's manpower, whatever it's physical resources for protective, whatever resources. They didn't have training for them, for their employees in terms of prevention. They didn't know what to do, how to wear the mask, what sort of movement they should do between floors. So instead of looking at who's guilty or not, we decided to focus on what needs to be done now, going forward. And that's the reason we have taken the time and the resources with Madame Savoie and the people of our staff. Let's make sure we agree that those, I wouldn't say orders, I would like to call them directives, make sure those rules, let's call them rules, those rules are being clear and accepted by everybody. So they know what will be those rules going in September. So this is where we are.
Prochain média.
Hi, Samuel Pouliot, TV News. The plan is largely for seniors' homes, but what happens if there are outbreaks in schools? Do you have a plan for movement?
Can you just repeat your question? Because honestly,
it's okay.
You have a very good mask because
it's good. Yeah, the plan is largely for seniors' homes. Yes. What happens if there are outbreaks in schools? Do you have a plan to limit movements of substitute teachers?
Okay. Maybe I can ask Dr. Arruda to complete that, but I'll say the plan that we have prepared or we've done is really for health establishment this morning. That's clear. But there are many things that will apply to schools as well. The way we control, the way we do the testing and everything. So I think I will let Monsieur Roberge over the next few days to explain what will be done, because I remember last week I was talking about those corridors that we need to have to make sure that we have the testing. But the principle, if I may summarize it, the principle of having a one person responsible per school will apply the same thing as we apply for health. So in school, that's a director or a principal, and he will have clear directives at what he has to be done within his school for prevention and control of infection. This is one of the key things. So, but I'll let Mr. Roberge explain that in the next few days.
Maybe Dr. Arruda can answer this one. Could we get to a point where we see interregional travel be shut down again?
We hope we won't do that, it's clear, because in fact, I will say that everybody is now evaluating even opening the frontiers. So, but you know, in this, it's always difficult to say no because we never know what could happen. But in fact, what will be important, and I think the virus is probably over everywhere in Quebec, except in certain places. I think the best thing is to fight against it, detect rapid intervention, and all based on the school issue you ask. I can tell you that parents, teachers, directors, public health, education have a plan to work together to, I would say, control those situations. It's clear there's going to be cases in school or elsewhere because the virus, even they can get the virus in their family or a party for kids and not in school. But what's going to be important is that in school, kids at not a high risk, but we will do everything to control when there was cases and lower the rate of transmission.
Merci.
Merci tout le monde. Merci beaucoup.
Thank you, everyone.